right, Dylan, thank you for that live report. And we continue our coverage now of the mass shootings out of Lewiston, Maine, with a focus on mental health challenges that can follow.
Western Mass News reporter Daniel Santiago joins us live in studio after getting answers from a psychologist who deals with trauma stemming from such devastating situations. Daniel, what did she tell you?
Chris, Abby, today I spoke with Dr. Deidre Hussey, who tells me gaining a sense of control and safety after a high-stress emergency is the most important thing that a victim, their families, and anyone feeling traumatized can do to protect their mental health. Another deadly mass shooting in the United States, this time in Lewiston, Maine. With this type of news often comes numbness, sadness, and fear. But Dr. Deidre Hussey, the behavioral health clinical supervisor at the Bay State Family Advocacy Center, warns of other reactions.
And some people may have grief reactions. Some may have physical symptoms, like really more headaches, stomach aches, or you may see people with more depressive or almost developing what we call like post-traumatic stress symptoms. So maybe a lot of intrusive thoughts or images or trying to imagine what happened, especially with just how we can be inundated with pictures and images in the news. Or people may be more on edge or hyper alert.
Dr. Hussey tells Western Mass News all of those reactions are normal, especially when dealing with the aftermath of such tragedies. And she recommends everyone, whether directly impacted by the shooting or not, should reach out to a mental health therapist for resources to help, especially when kids and teenagers are involved.
I think really validating the fear of going to a bowling alley or other areas, where kids would typically go, that can be scary, right? I think it's really scary. I think these can be really scary conversations because it's affecting us, either as caregivers, professionals, educators, those who work with children, but knowing that these things could be impacting us as well. And I think that makes the conversation really hard.
Hussey adds, through the recovery process following a mass shooting, mental health and gun violence are often linked together. A common thought, she says, could lead to discrimination and stigma around mental illness.
When there's an event like this, and it is so distressing, and we are experiencing these kind of post-trauma reactions, and everyone's really heightened, those become linked very quickly when they shouldn't be, right? To say that there aren't things that we need to consider on both ends, but I think when we're talking about these issues, we really want to think about policies and data as what it relates to gun violence, and how when we think about policies and data related to mental health, and then have conversations about them together rather than just immediately linking that these are always the case.
Dr. Hussey also recommends limiting social media exposure, establishing a healthy routine, and connecting with people who can make you feel safe to protect your mental health. Reporting live in studio, Daniel Santiago, Western Mass News.